Have you ever told yourself, this isn't a RA flare, I'm just tired, stressed, or maybe overdoing it? Weeks later, the swelling, the pain, and the morning stiffness are worse, and your lab results and your x-rays show more damage to your joints? Today, we are going to walk you through the biggest flare management mistakes, like ignoring early warning signs, waiting too long to adjust your treatment, or over-relying on pain medications, and find out later what actually protect your joints and your long-term health. Welcome back, RA Warriors. This is Dr. Nanda Subedi, your rheumatoid arthritis coach at the Rheum Doc, and I'm a practicing rheumatologist here in Cary, North Carolina. Today, we are trying to clear the confusion regarding rheumatoid arthritis flares. Please stick around. Before I go further, please download your free gifts, the RA bundle, which includes the free rheumatoid arthritis book and the early No More RA smoothie. And please also like and subscribe. It helps us reach more RA warriors who are suffering in silence. And we have a big goal for this year of 2026 to touch at least 100,000 RA warriors by the end of the 2026. Please help them by subscribing and sharing this information. Your one click will change their lives. Now, let me start with a story of one of our patients. Let's name her Anita. So she came to me to help with her rheumatoid arthritis. Now, I remember I was in the exam room number 3 in my Cary office. It was a rainy Tuesday afternoon. As I entered the room, I was Anita reaching into her large purse. She pulled out a gallon-sized Ziploc bag and dumped it into the exam table. I heard the sound of dozens of orange pill bottles spilled out. Empty prednisone bottles, empty ibuprofen bottles, and leftover pain medication from 3 years ago. She looked at me and then tears rolled through her eyes and she said, "Dr. Subedi, I am just trying to survive this week. I take a little of this, I take a little of that, whatever gets me to work. But the fire of inflammation never stopped affecting me." In that moment, my heart sank. I thought to myself, she's fighting so hard to be a hero for her family, but she's fighting with the wrong weapons. If we do not stop this cycle, she is going to end up with brittle bones, a damaged heart, or joints that cannot be fixed. Now, all of you RA warriors, does this story sound familiar to you? Are you caught in a cycle of pain, random pills, prednisone, and more fear? Today, we are going to stop this cycle. I'm going to show you the 7 most important mistakes RA warriors make with flares and exactly how to fix them. Science tells us that treating rheumatoid arthritis flare the wrong way, using too many steroids or waiting too long to get help, can lead to long-term damage. But there is always some hope. We are going to use our NSAIDs and the 4F framework to move you from pain to the possibilities despite these RA flares. Now, let's start with the mistake number 1. I call this the confusion. And the mistake number 1 is overthinking that every ache and pain is a full-blown RA flare. A true flare usually means 3 things: swollen joints, stiffness that lasts for hours in the morning, and a change in what you can do, like not being able to hold your coffee cup. A bad day might just be a soreness because you gardened too much or did not get a good sleep. But if you're confused, don't panic. Just ask this question to yourself: is this inflammation or just a simple irritation in your joints? If it is just a bad day or irritation, you need rest and icing. You don't need those heavy drugs to treat a true rheumatoid arthritis flare. Now, if you are not sure, just ask your doctor, ask your rheumatologist, let them know how you are feeling. They will guide you whether this is truly a flare or not. Now, the mistake number 2, I call this the steroid trap. And this is the big one: using prednisone for every time you hurt, thinking that this is a RA flare. Now, if you remember Anita, our patient earlier, she treated prednisone like a debit card. She used it for every purchases. But steroid actually is a credit card. They feel great when you spend them, but you pay a very high interest rate. That includes bone loss, weight gain, diabetes, and heart risk. Most of the recent rheumatology guidelines say steroid should be a bridge, not a destination. remission. We use them to get to you from point A, that is the pain, the flares, to the point B, the control of the flare, or we call remission. But we don't live on the steroid bridge. So try your best to avoid this mistake number 2 of overusing steroids. Now, the mistake number 3 is turning off the fire alarm with just non-steroidal anti-inflammatory, or let's call this NSAID overuse. Taking ibuprofen or naproxen, which are a class of medication, we call them NSAIDs, constantly is a big problem. Now, you can imagine your house is on fire, like rheumatoid arthritis. The fire alarm is ringing loud. Taking NSAIDs is like pulling the batteries out of the alarm so you don't hear those noise. The noise stops, but the fire is still burning the house down. Now, in rheumatoid arthritis, the NSAID help pain, but they don't stop the disease from eating your bone. We need to put out the fire, not just silence the alarm. So avoid these mistakes of overusing non-steroidal anti-inflammatory. Now, the fear number 4, and this comes in a lot of our patients, we call this fear of leveling up your disease-modifying anti-rheumatic drugs. Many of my RA warriors are scared to change their main medications, the disease-modifying anti-rheumatic drug, or even biologics. You will think, I will just tough it out. But the truth is, when you delay leveling up your RA treatment, the RA becomes harder to treat. It's like waiting for a small leak to flood the whole basement before you call a plumber. But we have a good plan to avoid this mistake. If you are flaring often, your base medications isn't working. We need to adjust it to protect your future joint function. Always consult with your rheumatologist to level up your disease-modifying anti-rheumatic drug treatment. Now, the mistake number 5 is ignoring the whole person treatment. Flares aren't just about joints. They are about what you eat, your nutrition, how much you sleep, and your stress. Studies shows that poor sleep and high stress increase inflammation in the blood. If you treat the joints but ignore the stress, the sleep, the flares will come back. So you need to focus on those holistic way of managing your health. And that's how our NESCAR comes into handy, the NESSCAR framework. Now, the mistake number 6, no fire drill plan. When flares hit you on a Friday night, do you panic? That's your mistake number 6. But we have a solution, and the solution is you need to create your fire drill plan written down with your rheumatologist. You have to have 3 different things that should be written in your written plan. That includes, number 1, who do you call? What medication can you take safely? And the number 3 is, when do you call your rheumatologist, or when do you go to an urgent care? So have those things written down as your action plan for managing flares. Now, the mistake number 7, fighting alone. Trying to be the tough guy or girl may not help your flares or your arthritis. We need family, friends, faith, and a fulfillment. Isolation makes pain hurt more. Your brain processes social pain or the physical pain in the same way. You need a team to fight rheumatoid arthritis and your flares. So have your team ready. Hence, don't fall into these mistakes of fighting your RA and your flare by yourself. Make a team, including yourself, your rheumatologist, your family, and the friends. Now, let me quickly recap and let me get you back to our patient, Anita, in the clinic. Now, I sat down with her, I took the back of the pills and set them aside. I pulled out a blank sheet of paper and I said, Anita, we are going to stop chasing this pain. We are going to get ahead of it. We made a plan. We adjusted her main disease-modifying anti-rheumatic drug medications. We stopped the random use of steroid, and we also focused on her sleep and also got her husband involved for helping her during those flares. And I saw her back 6 months later. Anita walked into the clinic. There were no Ziploc bags. She was smiling. She was back to teaching, and she moved from the survival mode to the living and thriving mode. So think about this question. How can you do what Anita did? And I have this simple 3-action plan starting today. Number 1 step is the 3-month look back. Look at your calendar. How many times did you take steroid or extra pain medication in the last 3 months? If it is more than twice, write it down. You need to show it to your rheumatologist so that you can change your treatment plan. Number 2, build your fire drill card. Write down the doctor's name, their phone number, your pharmacy number, and one flare buddy, either your family or a friend that you will call when you have a flare. And the number 3 is eat one anti-inflammatory meal today. Tonight, do one thing: a green smoothie, a piece of salmon, or a handful of walnuts. Remind your body you are on its side in fighting the rheumatoid arthritis. Now, all of you RA warriors, if this video gave you the clarity, please like and subscribe. It helps us reach more RA warriors who are suffering in silence. And we have a big dream this year. We want to touch at least 100,000 RA warriors who are suffering with rheumatoid arthritis. And please help them just by subscribing and sharing this information. And please don't forget to grab the free RA guide and the free No More RA smoothie in the description below. And all of you RA warriors, please remember, you are stronger than your pain. And let's move from pain to possibilities and from confusion to clarity. I will see you in the next video. Bye-bye.